Are you sure? All right, I want to welcome everybody back to our live presentation. We haven't done this in a while, so I'm excited. We have a brand new studio here, but today we're going to talk about an amazing scientific research that's going to offer hope for back pain sufferers. Now, I think this is a breakthrough. This is new research that really validates that treatment for the disc is possible without drugs or surgery. And this research is for patients that suffer with herniated discs, bulging discs, degenerated discs, stenosis, spondylolisthesis, sciatica, and really failed back surgery. So it's all the conditions of the disc. If you have a breakdown in the disc and you have pain that's not going away, this research is about you. Chronic back pain sufferers, really, the outcomes aren't very good with traditional therapies. Percent of the population is going up every year, meaning more and more people have back pain that's not going away. And if you have back pain that's not going away, typically it's the result of the disc. We're just going to do a real quick sort of anatomy lesson. This will just take a second. Typical spine looks like this, 24 vertebrae between the head and the hips. Between each vertebrae there is a disc. So the vertebrae are the bones. In between each vertebrae there is a disc. Now if you have pain that's not going away, it's from the disc. What can happen is the disc can start to break down. There's a weakness that'll develop in the disc, and very often the disc is a lot like a jelly donut, but what happens is the outer portion of the disc will start to break down, and that is the annulus. So when you get a breakdown in the annulus, sometimes you'll get little tears that'll develop, and these tears over time will start to lead to the bulging disc, the degenerated disc, and all those things we talked about kind of looks like this. So the disc is a lot like a jelly donut. The outside of the disc, there's a thick material we call the annulus. The inside, there's a jelly-like substance, and what can happen is this jelly-like substance can start to push its way to the outside. You can develop little tears, and as it starts to tear, what will happen over time is you'll get the hernia, the bulging disc, the herniated disc. Sometimes you'll get an extrusion where the nucleus comes all the way out to the outside. So it's a breakdown of the disc that causes chronic back pain. And traditional treatments for chronic back pain, and we've talked about these in the past, are physical therapy, chiropractic, injections, surgery, and the effect is not very good, or the outcomes are not very good. Now, we discovered at the Illinois Back Institute in 2007 that we could start to make some subtle changes inside that disc. And we did a study, and during that study we found out that we could start to get rehydration of the nucleus, but more importantly, what we could do is we could start to eliminate some of the herniated discs, and we could eliminate the bulging discs. So what we know is through our process of functional disc stabilization that we can start to get some healing, and that healing will start to make you feel better. More importantly, we did a study, and what we found is it's not just good for the bulging disc and the herniated disc, but it's very good for sciatica. We have the ability to take the pressure off the nerve. So as we take the pressure off the nerve, typical spine, one vertebrae on top of the other with the disc in between. A herniated disc, what happens is the nuclear material will start to migrate into the inside. And what we found with our therapy is as we take the pressure off, the nucleus will start to move back to the inside. And as that nucleus starts to move back to the inside, they'll start to feel better, and that sciatica will start to go away. Another patient here, one vertebrae on top of the other with the nuclear material pushing into the spinal canal. Herniated disc, went through our therapy, we take the pressure off. As we take the pressure off, the nuclear material starts to move back to the inside. More importantly, the patient starts to feel better. More of the same. Another herniated disc starts to move back to the inside, same thing here. Now, we did a study in 2016 that was just recently published. And what we did is we compared our therapy to traditional physical therapy. And the goal was to identify what happens to the patient, what happens to the disc, but in the end, what is the outcome of our therapy? Outcome is a variable of how much better you are. How much better is the pain and how much better is your disability. So we use two variables. We use pain and what we call the Oswestry Disability Index. The Oswestry Disability Index is a 10-question questionnaire that helps us identify how disabled you are as a result of your back pain. The higher the score, the more disabled you are. So what we're looking for is we're looking to see what kind of outcome you had as a result of the therapy. What sort of changes took place as a result of the therapy. So patients that came into our clinic, well, we compared physical therapy with the Illinois Back Institute treatments. Average patient that started physical therapy, their pain on a scale of 1 to 10 was a 7.9. 10 is the highest, 1 or 0 is the lowest. And when they started therapy, their pain was 7.9. After their therapy, their pain was a 5.5. So their pain had dropped down by 2.4. Our patients had started with a back pain of 7.4, and after they went through our therapy, their back pain was 2.4. So what does that mean? It means their pain had dropped down by 5 points. The Oswestry Disability Index, which is a questionnaire, again, it's from 0 to 100. Patients that went through physical therapy with these conditions of herniated disc, bulging disc, degenerated disc, before treatment, their Oswestry Disability Index was a 41. After treatment, their Oswestry Disability Index was a 32. And again, this is traditional physical therapy for patients with herniated disc, bulging disc, degenerated discs. So they had an improvement of 9.1 in their Oswestry Disability Index. Our patients, when they started, they had 46.3. At the end, they had a 25.5. So what does that mean? It means there was an increase or not an increase, a decrease of the Oswestry Disability Index by over 20 points. So what does that mean? It means that we were getting some healing in the disc. And through that healing, the patients started to improve, and their pain went down, and their Oswestry Disability Index went down. So when we score a patient's ability to improve, what we score, more importantly, is the Oswestry Disability Index. In medical literature, when you read medical literature about scientific studies, they talk about the change in disability. How much less were you disabled? How much improvement in your Oswestry Disability Index? So in this particular case, traditional physical therapy for all the chronic back problems, the herniated, the bulging, the degenerated, the stenosis, all the things we talked about, this is the average improvement that you'll see. And with our program, this is the average improvement that you'll see. So what does that mean? It means if you've suffered in the past and you have not gotten better, this new research identifies that the best form of treatment is functional disc stabilization, which is the treatment that we do at the Illinois Back Institute. The recent study was published in December of 2016. This is a copy of the article, and if you go to PubMed, which is the government database for scientific studies, and you type in the Illinois Back Institute, and our study will come up, so you can take a look at it right there. It's comparison of multimodal interventions. Now tomorrow, I know I made this very confusing and we haven't done this in a while. Tomorrow we're going to talk about comparison of 1,200 case studies. And what does that mean? It means we compared our therapy to surgery, to injections, to chiropractic, to physical therapy, and we'll talk about that tomorrow, and we'll give you an idea of what that looks like. So today, we haven't done this in 6 months. We're going to start doing these every day again to get you back on track. This is all about back pain and finding solutions for you. So if you like what you hear, I want you to follow us on Facebook and subscribe to our YouTube channel. We're going to start doing videos every day, and our goal is to help you eliminate your back pain. So that's it. I'm out. Have a good night. Be careful and drive safe.